So I will be introducing our next panel, which I'm pleased to report is called The Recovery from Inequities Exacerbated by the Pandemic for Children and Adolescents with Developmental Disabilities in Canada and the US. Our Canadian speakers include Dr. Jennifer Zwicker with the University of Calgary and the Kids Brain Health Network, and Gillian Backlin with the Child Bright National Youth Advisory Panel, who will be joining us with a video recording today. Our US speakers include Dr. John Constantino with Children's Healthcare of Atlanta and the Emory University School of Medicine in Atlanta, Georgia, and Diane Southard with the Parkway Parent Advisory Council for Children and Disabilities in St. Louis, Missouri. Thank you all so much for joining us today.
Priority should be to get as many different experiences as possible. I'm a person living with a disability, but I'm not obviously not I can't represent everyone with a disability. We're all very different. So maybe getting like we did with the project, getting different feedback and different experiences involved in policy, so that if this happens again, we're more prepared. During the pandemic, like I said, there was some isolating aspects, but I think fairly quickly it got realized that these things there needs to be a second look at, or ways that we can improve. So it was more, we're all sort of in this unprecedented situation, as they called it, together. So trying to figure it out as we go. And I think that there was a lot of cooperation as far as it being a collaborative and learning process. I think that for me, one of the major experiences that was positive that came out of the pandemic was more acceptance for things such as distance, doctor's appointments, or that kind of thing being a bit more accessible instead of having to go in person. And that has sort of continued as far as work goes and things like that. Yeah, so I think the general feeling in the pandemic was isolation, and like I said, there has been steps to combat that, whether with Zoom groups, things of that nature. But I think it highlighted the need for connection that goes beyond a screen. So I think that was an interesting realization that I personally had. Being a homebody anyway, I still struggled being isolated. So it's obviously not everything can be gotten from a screen at home. As with most things in the disability sphere, I think a lot of decisions are made on behalf of people with disabilities without directly consulting them. So I think what I would like to see is more people with disabilities being in a consulting or a lived experience type role within policy making, so that those um, considerations such as the mask mandate, etc., didn't have to be learned from, oh, this doesn't work for everyone. It could have been said from the start from someone's lived experience. So that would just kind of not only quicken the process and the key points that should be considered, but also just if we're considering those with disabilities should be the ones that are consulted. So I think that's what I want to see as a whole, not only in this context. Yeah, I think in the advisory council, we talk about meaningful engagement because a lot of times, while there's good intentions for engaging those with disabilities or those of a minority group, sometimes it can turn into more of a token representation versus authentic representation. So I think what's most important is not only to look for those people to fill out your advisory. In my case, it's brain-based disabilities. Oftentimes as well, people with disabilities who have education in certain fields that's sort of overlooked because all that people are looking for is a lived experience with disability, when in reality, I can bring experience or knowledge from many different parts of my life.
It was great to hear Gillian's perspective. We had a little bit of a delay in the beginning, but she was really articulate in describing how important it is to include individuals with disabilities in decisions that will involve their care, and then also remembering that they have much more to offer than just talking about their disability. So I appreciate those important points that she made, and she was delightful to talk to recently about these issues. So Jennifer, we're going to turn it back over to you to pick up where Gillian is leaving off. Thank you.
Perfect. Thank you. Well, thanks everyone. And, thanks for the opportunity to be here, but also thanks to Gillian and our advisory council for all the advice they put into kind of all stages of the research I'm going to share. Really just want to echo that point that there really has to be kind of those youth and lived experience voices. And I think all of this work going forward. For children with disabilities, really meaningful participation in society is facilitated through supports and services. This is in line with the commitments to the UN Convention on Rights of Persons with Disabilities. And this is a figure that's by Hafton et al., kind of looking at the developmental trajectories of sort of a healthy trajectory, an at-risk trajectory, a delayed disorder trajectory. And critically, policy support services have tremendous impacts on kind of changing the course of development for children, recognizing that there's multi-sectors involved in this space. What I'll focus on today is that COVID-19 policy has really shifted and impacted existing services and supports. So in Canada, we have the Canadian Survey of Disability, and this is just a little bit of data for youth age 15 to all the way up to adulthood and 64. And we know that about 70% are having activities of daily living going unmet, and educational outcomes, about 40% are not completing high school, and about 30% are completing post-secondary. Employment outcomes, about 65% are not in the labor force, and mean personal income is about $16,000 Canadian a year. So, to change some of these outcomes, we have to recognize that there's a need for investment and supports kind of throughout the life course, particularly in childhood and early childhood, and that the return on investment in that space is tremendous. So some of the key messages today that I'm hoping you can take away are really that, building on Gillian's points, really that there's been disproportionate impacts of the COVID-19 pandemic for youth with disabilities and their families. And to address this, there's a need to really think about building back better and designing and implementing disability inclusive policy, supports, and services. And the way to do that is really through co-design and using those principles of nothing about us without us. And so this is a map that a parent drew of the supports and services that They navigate on behalf of their child with a developmental disability. And obviously, it's a very robust network of services they have to navigate, multi-sectoral, very complex, and this doesn't depict all the kind of challenges and paperwork and eligibility and access issues. It's characterized as a very fragmented system that's been a persistent issue for youth with those developmental disabilities and their families in Canada. During the pandemic, though, there's in this added layer where many of the supports and services were delayed, disrupted, or denied to families. So there was this shift towards many supports just not being available that were previously available. So this added an additional layer of complexity that had profound outcomes for some families. This was a parent participant from one of our studies who said, when the school shut down, all his therapy stopped at home right away. That week, my son ended up becoming extremely violent. He was admitted to the mental health unit for 5 months. He was in and out of a hospital, only home for a few days in between every time. So just recognizing how, this access to supports and services are really critical and can have really much more profound impacts on families without adequate support. So, this disproportionate impact's been characterized. There's an excellent support through the Royal Society of Canada that's been put out among many other documents. And some of the guiding principles are really nothing about us without us, and thinking about this disability inclusive approach. When you talk to families, caregivers, self-advocates, there's this feeling that in the response, they were so busy dealing with the rest of the world that people were feeling very left out. And there's a recognition from advocates in particular that there's a need to be able to accommodate everybody, and that you can't have a one-size-fits-all approach in order to do that. So I'm going to run through just some very brief findings from a number of studies we've conducted in partnership with our advisory councils and many researchers in Canada here, and really highlighting that this disturbance, the COVID-19 policies and health measures, had a lot of impacts and sort of delays, denials, disruptions to services. And the implications were really the changes to the lives of youth with neurodevelopmental disabilities and their families. So through interviews and surveys across Canada, we found that there were really a lot of changes to mental health for youth and for caregivers. Impacts on academic success was a big outcome. Deconstruction of social networks, changes to access to society, impacts on developmental progress, and shifts in caregiving capacity, with caregivers having to take on additional roles that they weren't prior to the pandemic. In another study, we've looked at particularly young children and their families, and this was a survey about 2,000 people in Canada, and then a number of follow-up interviews, and found that there was, for parents and caregivers, really compromised mental health due to many of the additional and competing demands they were experiencing. One parent was saying no childcare support meant decreased mental health, and some concerns regarding children's mental health in terms of sort of their developmental progress and socialization, much to like Gillian was talking about, and sort of forming connections. And then thinking about new mothers, thinking about the additional challenges and sort of accessing support for postpartum depression and kind of community and connection was another common theme that emerged. So when you're thinking about lessons from the COVID-19 pandemic to really design and implement disability inclusive policy to address some of these systems, we've conducted a number of focus groups and follow-up interviews and surveys with participants across Canada, and they've highlighted some common themes around principles that need to be present in disability inclusive policy. And when we say disability inclusive policy, we mean policy across all aspects of policy, not just sort of for persons with disabilities. So, for example, emergency responses in general. And these include principles of equity and fairness. So thinking about some of the systematic and equitable distribution across different groups, principles of belonging, inclusion. So having that to be a core concept from the start. Thinking about system capacity for change, recognizing that, for example, many were highlighting the education system can't be the one-stop shop for all aspects of child support, and thinking about respect for families. So recognizing that it's, supporting the family is one of the best ways to support the well-being of the child as well. So within disability inclusive policy design, there were some really core themes that people highlighted. Inclusivity and accessibility lens was critical, and that comes only through co-design with relevant stakeholders and promoting inclusivity. Thinking about continuous access to inclusive education and disability supports. And it was emphasized there was a need to reduce reliance on the education system and think about more of an individualized approach that kind of is flexible to the needs of different individuals. Thinking about income and caregiving supports was a big theme that came out of some of the findings, highlighting the need for widespread specialized care, childcare, workplace accommodations, job protection policies for working parents with youth with disabilities, and also designing fair and sustainable economic supports for parents and caregivers of youth with disabilities. And then finally, the disability inclusive essential services was a key piece alongside mental health supports. And it was recognizing that disability services need to be deemed essential services in emergency settings and kind of in all contexts going forward. One example of that was a care coordination program that's being run through the Alberta Children's Hospital here in Calgary, Alberta. This is a support care coordination. Nurse coordinators work with families with complex care needs and develop a care coordinated action plan, and family empowerment is kind of the goal. And this was put on pause temporarily during the pandemic and then kind of reinstated. And, there was a real finding that there was a need to prioritize care coordination as a protective factor to reduce some of the health disparities and systemic inequities that exist. Care coordination certainly has improved impacts on quality of life for caregivers. It improves system level appropriate and timely access to care, family empowerment and engagement, and also communication between family and care provider teams. And during the COVID-19 pandemic, it was highlighted that this recognition of care coordination as a protective factor was a critical ingredient to kind of ensuring that these families were supported beyond kind of the demands just within the family itself. And there's a need kind of going forward from a policy and system level to support care coordination during emergencies as an essential service rather than kind of seeing it as an extra or an add-on. So I'll just wrap up with recognizing that all of these priorities and directions are directly advised through kind of stakeholder consultation and advisory councils, and this comes from parents and caregivers, youth and representatives like Gillian, and representatives from advocacy and community organizations, and that there's a need to kind of think about diversity across, life stage and life course, but also location and many other kind of intersectoral factors. So, this has changed the trajectory and the outcomes of a lot of the findings from the work, and is, I think, really fundamental in sort of child health research, but also certainly in disability inclusive research and policy. We have some digital stories that are shared from Gillian and another one of our parent advisory council members, Sarah. You can access them here. And I just wanted to wrap up with those key messages on recognizing that going forward, we need to make sure there aren't these disproportionate impacts for children with disabilities and their families. We need to implement some of the disability inclusive policies and practices early and in planning going forward, starting now, and thinking about co-designing as kind of the means to achieve that direction. And so I just wanted to thank our research team and collaborators and the funders that have supported a lot of this work.
Wonderful. Thank you so much. You covered a lot of material, I know, in a tight time frame, so we appreciate the wonderful overview, and we look forward to some questions after we hear from John and Diane as well on their work in Atlanta and in St. Louis, Missouri. Thank you.
Thank you for allowing Dr. John Constantino and I to speak on the recovery from inequities exacerbated by the pandemic for children in adolescents with developmental disabilities in the United States. Next slide, please. Hello, my name is Diane, and I want to share a little of my family story with you. I am proud to call these 8 amazing people my children. This photo was taken in August of 2020 on a vacation planned the year before when COVID was not even on our radar. This is a day I will always remember. Our family awoke at 4:30 a.m. to a tornado warning and hunkered down in a closet together, followed by waiting out a tropical storm. However, by noon, we were out on the beach and enjoying a beautiful day. It reminds me that whatever we must weather, there is always hope. My children are sitting in age order from oldest on the left to youngest on the right. 5 of these children have a developmental disability, and back in 2020, and still currently, receive individualized education plans, or IEPs, to support them in school. Of these 5, 3 have significant developmental disabilities. Those 3 continue to require one-to-one support throughout the school day to help keep them on task. My oldest and youngest sons use very few words, though my youngest one uses so many more words now than he did 3 years ago. And my middle daughter did not and still does not use any spoken language. They do use augmentative communication devices to assist them, though. Next slide, please. While structure is not a unique concept, it is definitely necessary for my family and perhaps may look a little different. Most of my children are visual learners and require extra processing time for comprehension. They all deserve to understand what the expectation is, how it will look, and how long it will last, and what comes next. When we go on family vacations, my husband and I create a book for each day for all of the locations we plan to travel to and coordinate visuals to match those. We love traveling, and my kids do so well when they are out in nature. We just need to communicate in a way that my children can understand. These modifications were provided for them at school as well. These 3 children would have a visual schedule of their day and then visual task schedules for the activities they would complete throughout the day. This would help them participate alongside their classroom peers as much as possible and under the support of their para, their teacher, or therapist would work on being as independent as possible. But it was during this vacation I learned that while my oldest would return to college for her junior year, the other 7 children would not be returning to in-person school, and all education would be delivered virtually, regardless of their individualized needs. Move to the next slide, please. Gone was the structure and routine of the school day. Gone was the visual schedules and visual task schedules the teachers provided to support their learning throughout the day. I was one person who was tasked to support all my children's educational needs, even though the school was supposed to provide these supports written in their IEPs. My kids' teachers and therapists worked so very hard to try to create supports to help, but it just didn't even come close to in-person learning. I had 2 children who were independent. However, of the 5 with IEPs, only my 2nd grader was able to read some, and none of them could tell time. They each had a different schedule with different teachers, and it seemed we were constantly getting kicked off of Wi-Fi. After the first 2 weeks of virtual learning, my middle daughter, who was 9 at the time, became increasingly frustrated to the point she would run out of the house whenever I would help another child. She could not understand all these changes and rules, and her way of communicating through eloping was putting her safety at risk. I had to make some really hard decisions. I was not able to leave her alone at all, which prevented me from being able to support my 2 sons who also required that one-to-one support. But I needed to keep my daughter safe. Unfortunately, I had to make the decision to forego virtual learning and work with the teachers to create a new asynchronous curriculum so I could use the same activity and try to apply it to my 1st grader, 2nd grader, 3rd grader, 4th grader, as well as my high school senior. I was also blessed with 2 neighbors who volunteered to help 2 days a week with my younger girls so I could focus more on the 3 with more significant disabilities. My high school senior really struggled during this virtual learning. He would say the names of friends and teachers at school and wanted to go and had a difficult time understanding why he could not. He could not sit in front of a computer screen independently and participate. He needed extra processing time in virtual learning which was not conducive to his learning style. My son lost out on critical educational time to learn job skills and independence. Upon returning to school, he spent a lot of time relearning routines and the new normal, which also took away from those critical learning experiences. He recently turned 21, and the school will not consider allowing him to complete his academic year to continue working on those goals because they no longer have to. And within the past 2 weeks, they changed their online statement from allowing students to finish the academic year in which they turned 21 to leaving at the end of the academic semester they turned 21. Move to the next slide. We can do better though. Schools need to include all stakeholders in the discussion, which includes individuals with disabilities, caregivers, teachers, therapists, and professionals. There is no one size that fits all. We don't fit into a box, and some people really did well with virtual learning. I know a lot of people who had a lot of anxiety and had other things going on, and it worked for them. It did not work at all for my children. We need to keep the conversation going. What worked? What was missing? And what tools can we proactively create now to fill those gaps? My youngest son was participating in a longitudinal study at the time, which included a speech language intensive. I was trained in different ways to support my son's language development through play-based strategies. And those strategies really helped me as I had to support all my kids. And things like this can really help other people in the future if we ever have to go back to virtual learning. We need to identify opportunities to deliver these supports in the safest and most equitable way during school closures. And we need to acknowledge the learning loss that did occur and how we can help recuperate those missed opportunities. My oldest daughter has since graduated. She is now a nature-based occupational therapist in California. And what she learned through our COVID experience has actually driven her to make this career choice that she has done. And so positive things really have happened. And going back to the first slide, we just need to include all the stakeholders, especially the individuals with disabilities, which has been echoed several times, because together we are stronger. If you want to move to the next slide. With support and opportunity, all people are capable of incredible things. And I pass it along to you, Dr. Constantino.
Well, thanks, Diane, for that very powerful account of what transpired and how you and your family weathered the vicissitudes of the pandemic. I think there have been some incredible kind of recurrent themes around what is possible, and I want to focus my remarks today as a child and adolescent psychiatrist, as a pediatrician, as someone who is thinking about the child health system moving forward. What are the opportunities that have been created, and how do we think about preparing ourselves for a next kind of adverse event like this, and also heed the lessons that have been talked about from the very beginning of this webinar about the accentuation of inequities that exist all over our health system and child health outcomes. One of the things that happened in the evolution of the pandemic and the response to it had to do actually with an NICHD and NIH program that accelerated diagnostic processes for underserved populations. And this was applied to children that were just like the ones that Diane described in her own family, in which COVID-19 tests, which were a novel, rapid application of testing that right at the beginning of getting kids back into school and to make it possible to be safe as best we knew at the time for both children and teachers to re-engage in what was actually going to work for them for their education. This is a report that was just published in the journal Pediatrics on the experience of 81,000 COVID-19 tests that were performed across the nation in a multi-site study implementing these methods. And one of the take-home messages, again, something that has been echoed throughout this meeting, is that holding regular types of communication and interactions between the school setting, the academic environment, the community, and parents were key aspects of implementation strategies that had to be structured and had to be part of the solution, even when the tests were available and even when the technology existed for us to respond to a crisis like the COVID-19 pandemic. And so the establishing of these kinds of communicative partnerships have been viewed by this group as an absolute essential for responding to the conditions of a crisis, especially when vulnerable populations are concerned. So another aspect of the response to the pandemic was to make sure that literally the clinical community was apprised of all of the consequences of the pandemic on the people who it was affecting in this way, with a very severe kind of and different kind of impact than many in the rest of the population. So this was an attempt by leaders in the developmental disabilities community to actually broadcast to all physicians in the psychiatric, mental health, and caregiving arena for people with developmental disabilities at a time when lots of folks were concentrating on complex decision makings regarding would telehealth work and what were the shortcomings of telehealth. Were people with developmental disabilities going to be discriminated against in terms of the allocation of life-saving medical interventions? The importance of effective infection control practices to people who represented the diversity of risks for infection consequences for individuals with intellectual and developmental disabilities. But what people weren't talking about were secondary hazards with even higher consequences in the domains of an evaporation of a workforce for personal care, education, just as Diane was speaking about, and workforce support for people with developmental disabilities. And so making sure that in the context of a crisis, that all of these nuanced aspects of a way in which a stressor is now going to compound existing inequities. Exactly how is that stressor, exactly how is that crisis going to impact the people who are already at a disadvantage on the basis of inequity? I think this is a really important principle for crisis situations, stress situations, and any incurring of a next kind of pandemic, that we really need to make sure that people understand fully what the complete array of consequences to these populations at risk actually are. I want to talk about a pre-existing inequity also that was not only exacerbated by the pandemic, but during the course of the pandemic, it was actually learned that this particular inequity, which was one that was historically explained away on the basis of ascertainment bias, that once it was actually discovered, became somewhat of a mental health developmental urgency in clinical care for populations, in this case for minority populations affected by autism. And this is a slide from the Centers for Disease Control surveillance program for autism that had identified, starting in 2018 and then replicated again in 2020 and 2021, that Black non-Hispanic individuals with autism were essentially at double the risk for the comorbid compounding of intellectual disability versus white non-Hispanic populations and other other populations within the nation. And the idea that this particular disparity would result in this level of compounding of a developmental disability condition, autism, with something that is severe and as long-lasting and as impacting as intellectual disability, that the magnitude of that distinction historically had been explained away by saying that, well, it was only people who had the worst syndromes that were identified in the community, and people with intellectual disability and autism were the ones who were the more severe kinds of conditions. And so it stood to reason that ascertainment bias would ultimately favor for populations that weren't having the same kind of prevalence or the same kind of discovery of their condition, that they would be representing disproportionately intellectual disability comorbidity. But it turned out that in these years, the prevalence for autism, as recognized in the community, had equalized across race. And what this meant was that this was a true disparity in outcome on the basis of the occurrence of a condition, autism, which is strongly genetically influenced, but then superimposed by factors that were resulting in Black, non-Hispanic individuals with autism having 50% on the level of 50% comorbidity with additionally intellectual disability. And this resulted in a very careful analysis of data before and during the pandemic of individuals with autism who were Black and non-Hispanic, and resulted essentially in the revelation that these disparities were not explainable on the basis of biological factors that were accessible in within the populations that were studied. This was the largest sample of African American individuals with autism ever amassed for such a study. The effects of income, the effects of the background characteristics of cognitive development of close relatives, family members, first and second degree relatives were considered. And the bottom line was that the data were shedding light on essentially structural racism as a driver of inequity for children with ASD, in that a very large number of children with autism were not getting diagnosed on time and were going through many misdiagnoses. And then there was really no workforce to respond to young children, especially affected by autism, and who needed developmental therapy or educational interventions, which would have spared them the consequence of this very severe comorbidity of intellectual disability, which then lasts with them for life. And so during the pandemic, what we were able to show was that if you diagnose early, and we were able to do that, and you are able to deliver the interventions that we know are capable of supporting young children and sparing these kinds of adverse outcomes, that indeed children who receive these interventions, we watch them improve over the course of the pandemic in terms of cognitive development, whereas children who did not get the standard developmental therapies and educational supports for children with autism were their adaptive functioning and their intellect were eroding over the same period. And so this is a study that I refer you to, that compared children who were diagnosed early to those who weren't, whether diagnosis alone or diagnosis and early treatment resulted in these improvements, and a very promising picture that we can resolve this very serious inequity. And then finally, I was just going to say a word about the fact that on the other end of childhood, which was also been talked about today, that the pandemic exacerbated what's referred to as dual diagnosis, the co-occurrence of psychiatric impairments or behavioral disabilities on superimposed on the conditions of individuals with developmental disabilities. And what we know actually is that there are interventions that are relevant to joint occurrence of developmental disability and behavioral impairment, that when they are applied, there is an evidence base which is assembled during the pandemic to really clarify to people that we have methods, positive behavior support, case management, in-home supports, of an array of psychopharmacologic interventions that would offset the impact of the pandemic in exacerbating these joint conditions. But so often, children and young adults were not receiving these kinds of interventions because they're typically packaged in separate bureaucracies that nobody has access to jointly to take care of these kinds of joint occurrences of these conditions. So to summarize, the pandemic disproportionately adversely affected children and families affected by developmental disabilities in ways that are not always immediately apparent, obviously, to legislators, community leaders, and policymakers. So the information on what are the nuanced factors that affect these populations really have to get out there, and some of the consequences are really able to be offset if we apply interventions that we know are capable of reducing the risk for the impairments that are associated with them. So I will stop there and turn it back over to the organizers.
Fantastic. Thank you. Thank you all for those very compelling descriptions of the inequities and experiences of children with developmental disabilities during the pandemic, and also for those lots and lots of discussion there of recommendations for policy and system change. We do have about, I'd say, 2 to 3, maybe 5 minutes. If anybody wants to ask questions, the Q&A box is still open. While we're waiting for other folks to ask questions, I was sort of mulling through all of those recommendations and findings. We've had a number of recurring themes during the day, but also recognizing this is hugely complex, all these multiple systems that interact. And I don't know if there's an answer to this question. If you could pick one thing as a next step that would have the highest impact, what one thing would you ask or would you implement to help improve this situation?
Well, I think Ruth, I mean, I think it depends on the age. I think for young children, I think this axis of timely diagnosis and application of developmental and educational supports is so very important. In the older ages, when the disparity manifests itself as severe behavior impairments, I think, you heard the accounts of, children for months being sidelined and young adults being sidelined by this. Again, one of the interventions that typically just gets lost in translation is the ability to implement positive behavior support programming, which is a science unto itself, along with appropriate medical psychiatric intervention. But oftentimes those don't come together because those come from separate bureaucratic worlds, at least in the United States.
Yeah, I'd maybe just add on to that I think there was, during an emergency situation, there was sort of this philosophy of disability support services being sort of a nice to have or an add-on. And, I think that has to change. So that would be the first thing I would change. And I think the way to change that now is to any sort of planning and infrastructure that's developed, that it's sort of built in and planned for, so you're not reacting during an emergency situation. It seemed like a lot of emergency responsive, especially in school systems in particular, that just hadn't been considered. So there was no adaptability or ability to kind of pivot quickly. And so the default was to just cancel supports altogether.
Right. Diane, would you like to comment?
Yeah, echoing what they both said, but ultimately include all the stakeholders, because I was on the, I brought my oldest home from Europe, and I talked to them March 13th of 2020 saying, I'm concerned you're going to shut down schools, and I don't think we have a plan in place. And I was assured, if this happens, I brought up the conversation well before it happened, and I was excluded from the table every single time. I had to speak for my children because they don't have the voice to speak for themselves, but their behavior speaks and lets me tell that. There are so many people who can verbalize, and people with disabilities and the stakeholders, the teachers who are working directly, therapists, and the paraprofessionals need to have a seat at the table, because if they were, we would not be in this situation that we were at fall of 2022.
Great. Yeah. Thank you all. Unfortunately, we have to wrap up now. And it's been such an inspiring and thought-provoking afternoon to hear from everybody. And I'd like to thank all of our panelists.